guys, I am Dr. Bidmos with Public Health Talks. I hope everyone is keeping safe during this challenging period. A little bit about me. I am a wife, a mother of 3. I love to cook and I love to sew. I have a bachelor in psychology, a master in public health, a PhD in public health with focus in community health education and health promotion. I think public health is a fantastic field because it gives me great joy to be able to educate communities around the world on how to live a healthy life and prevent diseases. Before the COVID-19 pandemic, I have been working on starting a weekly public health talks series with the intention of discussing challenging public health issues affecting you and I in different communities around the world. My goal is to have guests on the show to address some of these issues, how it affects them personally, their loved ones, and surrounding communities. It is intended to have an open conversation about these topics so that we can learn from one another. Occasionally, I will ask you guys to help choose public health topics for discussion, and I look forward to that. In addition to giving you guys a overview of what lies ahead for public health talks, I would like to remind us of some basic facts about COVID-19. Since the pandemic, I know we've been having different information about the virus, and I think it is wise to keep educating ourselves and reminding ourselves on the facts of COVID-19 and the preventive measures that have been put in place by WHO and other multiple public health outlets. Here's some compilation that I have for you on COVID-19. Number 1, do not panic and prepare accordingly. What that simply means is that, yes, there has been lots of misinformation going around. You just need to educate yourself on the virus and understand the preventive measures and make sure you practice those on a daily basis. For example, just learn how to do proper hand washing and how to properly cough or sneeze on your sleeve. Number 2, COVID-19 is an infectious disease. Well, that simply means that it can be spread directly or indirectly from person to person. That's why we see in different parts of the world right now, most countries are enforcing social distancing or social isolation, meaning you should stay indoors to avoid the continuous spread of the virus. Number 3, your nose, throat, airways, and lungs are the most affected parts. Number 4, COVID-19 is not a death sentence. As a matter of fact, most of the symptoms can be treated with timely medical care. And most people, about 80% of people who have mild symptoms recover fully. Meaning, if you feel you have the symptoms, I think it is wise to contact your local clinics or public health departments on how to get tested. For example, if you get tested positive or your test came back positive, you can start medical care immediately. Number 5, older people, 60 plus, they are the most affected population. So during this period, we should be mindful to keep tab on this population. So this way we can keep reminding them on practicing preventive measures that have been put into place. Remember, share facts and not fear. In the next video, I will be providing you with some tips on mental health and self-isolation and during this pandemic. So until then, stay safe and stay positive. Thank you guys.